Welcome to another edition of Talk City Greensboro, produced by GTN, featuring interviews and events happening around town. It's an easy way to stay in the know while you're on the go. Subscribe to Talk City on iTunes, Pandora, Google Play, or SoundCloud. We also have the City of Greensboro's YouTube channel as an option. Doing what we can to ensure you're up to speed with the activities happening in the Gate City. I'm your host, Rodney Dawson, around the big round table by myself. No Josh, no Rosemary, but I have two essential workers for the City of Greensboro here to talk about the important work they do at the Office of Community Safety. First, the Division Manager, Latisha McNeil. Welcome to Talk City.
Thank you. Thanks for having me.
And Behavioral Health Team Supervisor. Before I thought you said team.
Luckily, not all teens, yes.
Erin Williams, thank you for joining us here on Talk City.
Thank you.
And we're here to talk, we're going to inform some folks today because you're educating me. So I'm looking forward to what we're talking about. But we're mainly here to talk about an upcoming program in September, and we'll get into it more. But it's reentry simulation.
Yes.
What is that? When I hear that, I kind of know, but I don't know.
Yeah. So traditionally, there is a thing called reentry simulation that's done that basically gives average folks in the community the experience of what it's like to come back and transition after incarceration. You know, all the barriers that people face of not having a job, not having income, maybe not having a place to stay. What we're adding on top of that is the behavioral health component of not only do you have the traditional obstacles of reentry, but also we're going to give folks mental health diagnoses and additional things that they're going to have to navigate as well. So really understanding that lots of people who are in the criminal justice system have co-occurring mental health, substance use issues they're dealing with.
Okay. What, Miss McNeil, Ms. or Mrs., okay?
Miss
McNeil.
Or yeah.
Oh, Latisha.
Yep.
Okay.
Latisha's best. Yes.
Latisha's best. What kind of numbers are we talking about? Is it a major? I guess anything's a problem, but are there in great numbers here in Greensboro?
In terms of
reentry citizens looking for reentry programs or trying to get more acclimated with society.
Yeah, we do have a large number of returning citizens that are in our city. One of the good things about what we have is there are resources that are available to those folks. Our partners with Guilford County Reentry do an amazing job of trying to connect people with services and resources. So there's a need, but there's also, we've got individuals that are there to help.
And the money, those tax dollars going to support this. So
Yes.
we have to get buy-in from the community. So is this program raising awareness? Is it designed to bring people in so they're more aware of the factors that are faced by formerly incarcerated?
Yeah, I think the idea of this actually, it came from our Be Heart staff members going out into community and interacting with folks on a daily basis and wanting to have an opportunity for individuals to see, what it's like for someone to have to navigate the different systems that someone would have to navigate returning back into community, but then also with the mental health challenges that individuals may face, because a lot of times, we may see someone who is on the criminal end of a situation, but we don't see those mental health needs that maybe aren't being addressed in a manner in which they should, and how that can impact how they live their day-to-day life.
What can that look like? Without saying names, can you exemplify? Give me an example.
Sure. And, definitely just to highlight, so our team works with individuals in crisis. Some of those are reentering into the community. Some don't have criminal histories at all. But there's a wide range of mental health challenges. We might get called on somebody who is threatening suicide and are feeling really hopeless and dealing with depression. We might get called on people who are experiencing what we would term psychotic symptoms, so hearing or seeing things that aren't there, or believing things that maybe are not the reality. So it can be a very wide range. And I think what our team sees is that there are a lot of resources in the county, but it's difficult to navigate them, to know who to call, to know what times walk-in hours are for this place, to know how to get your medication without paying a copay. And our team really works hard to navigate those obstacles. But if you're doing it by yourself and you don't know the resources, that can be really tricky, whether or not you're having that criminal justice component on top. So I think with the reentry simulation, yes, we want to highlight the struggles that people are experiencing reentering, but also in general, just really show how difficult it is for people with mental health challenges to know all the steps that you have to do to get the services that people really want.
Latisha, for those that I'm asking, because I'm just asking, I'm hoping I'm representing an average viewer. Mental health challenges, I hear that, but it can be kind of broad to me. Break it down. What can someone say? And I don't know if I'm dealing with mental health challenges or not. What can that look like for someone that?
I mean, I think it can look a variety of different ways depending on the individual. I know for Erin and the team, what they see runs the gamut of individuals who, like she said, may be hearing or seeing things that aren't there. Could also be concerned family members calling to get assistance for that person. They may not even recognize that they are in a crisis or have a mental health need, but those around them may recognize that they need that. And it may, have gotten to the point where it escalates and a family member or, a concerned person calls 911 to receive some assistance for them. And that's really how the behavioral health response team, how they come into situations where they interact with folks is through people calling 911 for service. And we have a co-responder unit. So we have the behavioral health response team, and they respond along with specially trained GPD officers. And I mean, what we found through that is there's opportunity for a lot of follow-up care. There's supports that are needed. And, just through the day-to-day work from the office, that is one of the things that has speared the opportunity for this, just from seeing the need from individuals and us trying to figure out, what can we do to shed light on it.
Erin, I can call you Erin?
Yeah, sure,
All right.
Absolutely.
All right. Thanks for not embarrassing me if I couldn't call you Erin. And I'm really starting to understand a little bit more about OCS, community safety, but you don't think mental health.
Right.
You don't think, you always go to the doctor if we have a limb that's messed up or an ache, but doing preventive care for that mind or addressing issues with that mind is part of the safety. So I see how it fits in now. Yep. So you get the call, a concerned family member calls. What's step one?
So as Latisha said, we're dispatched through 911. So if a concerned family member or a resident calls for themselves out of concern, if there's anything in the call that sounds like it's mental health related, if somebody mentions depression or anxiety or a family member is having struggles or off their medication, anything like that, our 911 dispatchers are really good at recognizing that might be an issue that we can take, and they'll request that we go out.
Someone from your office, not police. Okay.
So we go together. So it'd be somebody from our office, one of our mental health folks in the green shirts, and one of our specially trained officers. They're going to arrive on scene together. Officer is always just checking out safety first, because you never know in different environments. And as soon as it's good to go, the counselor's in there asking questions, figuring out what that person needs. And sometimes people need to go to the hospital. Sometimes they need immediate care, but sometimes they just need a person to talk to. Sometimes they need a referral to a therapist. We get called out to a number of family disorders, kids and parents not seeing eye to eye, so maybe they need some in-home supports to help navigate that. Whatever it is in that moment, the counselor knows the resources to, again, be that navigator of, hey, your insurance is taken by this person. We can get you an appointment and set things up. I think people get to the point of calling 911 because they just don't know what exists.
Did you want to say something?
Yeah, I was just going to say, in regards to the Office of Community Safety, that's the nature of what we do. When people call 911, like Erin was just going to say, they don't always know what they need, but they need help. Right. And, what we try to do is be intentional about providing those community-based responses to help assist them. So whether it's through our behavioral health response team that responds to situations, or we have other programs under Office of Community Safety as well, like violence prevention. We have our law enforcement assisted diversion program, also known as LEAD. So there are other opportunities for our community-based responders to interact with community and provide community safety before we get to the enforcement end of the public safety continuum.
I only got you for about 20 minutes, so I'm going to try to squeeze some questions in. We have to get you to come back, talk about LEAD, and also about how it prevents calls later when only the police have to show up. Are there any other departments you work with closely? I know GPD and whom else?
So, yeah, we work with GPD primarily with the
I'm saying Greensboro Police Department.
Greensboro. Yeah. We work with code enforcement. We work with neighborhood development, Parks and Rec. We do a lot of work with Parks and Rec.
How does that look?
So Parks and Rec, primarily in our violence prevention space, we do a lot of partnering with Parks and Rec to try to help to give opportunity for young people that maybe need some guidance. Maybe they're on the fence of making poor choices, connecting them with community-based organizations, being able to support them in that way.
All right, that's good news. I didn't know that. So I'm sure others should take advantage of that. Is anyone, when you get the call, are people apprehensive in their response? And if so, what reasons, and how can you put that at ease? Does that make sense?
Sure. Yeah. I mean, absolutely. I think people are sometimes apprehensive to call in general. Although most people assume that people want to talk to a counselor over a police officer, that's not always the case. There's certainly stigma that still exists about mental health, and it can be weird. You're not expecting a counselor to show up on your doorstep when you call 911. But we try to just read the situation and meet people where they are. Our counselors are well trained that they don't always go up in every situation. Hello, I'm a mental health counselor, right? It's kind of just being a presence, like being able to talk to somebody. It's really just about trying to build relationships, and wherever the person is. Sometimes people will talk to us for 2 minutes, shut the door, that's fine. Sometimes people call us every day and, want some assistance and support. Like wherever the person is, our team is really good at meeting them there and kind of navigating what steps they're willing to take.
Gotcha. I'm gonna get you out of here on 2 more questions. Either one of you can jump in. I'm curious to know, and if you may not know this, but municipalities. How many municipalities are you aware of in the state, I'm thinking, that offers a service like this? I imagine it's cost prohibitive. Am I saying that? I imagine it costs a lot. But how many, is this common throughout the state?
I would say that to my knowledge, there's at least a half dozen that are doing different varieties. And nationwide, there's certainly a growing trend of alternative responses. And more rural areas or smaller municipalities might have one counselor, whereas bigger cities are going to have more. But I would say within North Carolina, Winston, Durham, Charlotte, Apex, Raleigh, Greenville.
Cary. Chapel Hill.
Oh, Chapel Hill, yeah.
Yes.
Okay, we're getting up to, a good number of places are really
good.
starting to expand.
And it actually is a cost benefit to municipalities because what you find is you have individuals who may be repeat callers or they may have repeat interaction, with law enforcement, not just police, but public safety in general. It could be fire, or 911. There are individuals who have very persistent mental health needs who get their needs met by calling 911 and having the fire department show up. And, so being able to provide a space for those individuals to get the help that they need saves our municipalities money in the long run.
I had a big check mark. You can't see from my scratch here, but my last question was the benefits. And so you jumped right. Good segue.
Yeah. Oh, thank you.
All right. Okay, we got a program coming up in September to help make the community aware of what you do and this particular aspect of it. Tell us a little bit more about that.
Yeah, so just to highlight, the week in September, our event is on September 18th. It's going to be between 10 and 1, but that entire week of September 16th is actual National Co-Responder and Crisis Responder Week. So the event is really, yes, to highlight the struggles of individuals dealing with reentry, dealing with mental health and substance use issues, but it's also to highlight the work of the team and how we fill a critical gap of helping individuals navigate in this space. And we're lucky in Greensboro that we exist, but our teams aren't everywhere and not, we don't operate all the time. So we want to really highlight the really good work that our co-response and crisis responders are doing.
Okay. How do you rejuvenate yourself, your team?
So for me, I'm really intentional about making sure that the team takes time to do team building, wellness. I'm really big on making sure that they incorporate goodness into their day. They know I really advocate hard for them to have those spaces where they can do things that are outside of the norm. And even this event it's not something that is within the normal scope of the work that they do, but it comes from the innovation from the team, and they have the freedom to bring those things to light, and they know that I'll support those because they are part of the greater good of the team. So
I steal terms from people. When they give me something that I like, for 6 months, I give them credit. After the 6th month, I take it as my own. But I like how you said incorporate goodness.
Yes.
So I'll give you credit for 6 months. Then it becomes my slogan.
How long does it take to trademark? I need to get on that.
Erin Williams and Latisha McNeil from the Office of Community Safety here in Greensboro, North Carolina. Thank you for joining us here on Talk City. A lot of good information you put out, and if anyone's like me, they weren't aware. So to minimize that or mitigate that, how can people stay abreast of what's going on with your office?
Yeah, so they can follow us on social media, on Instagram. We're at GSO_OCS, and on Facebook we are /OCS. Also, if you forget either one of those, we are on the City of Greensboro's website under the Office of Community Safety, and our events are highlighted on the city calendar.
Thank you for everything that you're doing. Thank you for spending time with us here on Talk City.
Thank you.
Thank you.
All right. That's it for Talk City. I want you to stay tuned in weekly by subscribing to iTunes or Pandora or even on Google Play. And don't forget, you can download Talk City from SoundCloud. That's it for this week. Our wonderful guest from Office of Community Safety. Thank you for tuning in to Talk City. Be sure to watch GTN, your official source for news and information about the city of Greensboro. GTN is available on Spectrum Channel 13, AT&T UVerse Channel 99, and Lumos 31. GTN also streams live on Roku and the city's website at greensboro-nc.gov.